We're going to talk about ACL revision or ACL re-tear. ACLs are a super common injury, and unfortunately, ACL re-tears are also a pretty common injury. Depending on the study, it happens about 12 to 15% of the time.
Especially in young, active, so for example, a college soccer player, it's incredibly common. And we see that a lot. We see a lot of second opinions and a lot of more complex revision cases like that.
So the key is to try to figure out if there were any risk factors that could have been modified to reduce the chance of re-tear. So we look at a number of things. We look at where the ACL graft was placed in the first case. We look at the shape of the top of the thigh bone to see if they have too much slope. We look at their overall laxity and if they hyperextend their knee.
And sometimes people have lost their meniscus completely, and meniscal deficiency is another risk factor. So you try and figure out why it failed the first time so that hopefully you reduce the risk of it failing the second time.
And so for sure, almost always, when we're doing a revision ACL, we add something called an LET. We do this in a lot of primary high-risk cases, but an LET is a little piece of the IT band that you tack down to the femur.
And it's belts and suspenders. So instead of just focusing all the stresses on one ligament, now you distribute them across two ligaments, so that's what reduces the risk.
In other cases, they may need a meniscal transplant. They might need an osteotomy to change the shape of the bone. There's lots of things we look at, and it's certainly a discussion with the patient, the best course forward.